Okay, so do you want to introduce yourself a little bit, how long you've been at South and what your research focus is?
Sure. Well, I'm Joe Currier. I'm a licensed psychologist. I've been part of the clinical and counseling psychology faculty since 2013. I think prior to coming to South, I was with the faculty at Fuller Theological Seminary for several years. My specific areas of kind of research and scholarship, as well as practice, focus on what I would call applied psychology of religion and spirituality. So trying to understand ways that faith and spirituality both help and hinder recovery from different mental health conditions, such as post-traumatic stress disorder. And I also focus a lot of my work on supporting military veterans, service members, and other military connected populations. So within that line of work, I spend a lot of my time kind of validating and seeking to understand the construct of moral injury, which I think we're going to talk about today.
Yeah, so can you tell us what moral injury is?
Absolutely. Well, in long answer to your question, I should say in short answer to your question, we don't really have a consensus definition of what we mean by moral injury as an outcome. That this is an emerging clinical construct right now. There is agreement that, broadly speaking, moral injury would refer to a particularly unique form of suffering that emerges from events that profoundly violate people's sacred beliefs and values that are usually of a moral nature.
So does moral injury, is it limited to people whose trauma involves themselves violating their own moral code, or does your definition include trauma that violates someone's moral belief system in general?
Yeah, absolutely. Good question. So there are three different kind of types of potentially morally injurious events. So in order to develop moral injury, first, there needs to be an occurrence of a potentially morally injurious event. So one type of event would be what we would call perpetration-based events. So in these cases, someone directly inflicts violence or trauma on another person, where they're the direct agent of potential moral wrongdoing, right? There's also like what we would call betrayal-based events. In these cases, the individual is the subject of another person's wrongdoing, right? So thinking about sexual assault, for example, that there's an inherent kind of moral wrongness about many of the interpersonally mediated traumas. And then a third kind of type of potentially morally injurious event would be what we would call kind of more of a act of omission, where maybe someone believes that they're somehow responsible, for severe harm to another person, more on the basis of a lack of ability or resolve, or capacity, to right a wrong or to stop that from happening.
So would like survivor's guilt fall under that category?
Yeah, absolutely. Yeah.
So in the trauma lecture, I taught that interpersonal violence is the type of trauma that's most likely to lead to PTSD. Do you think that that's because of moral injury as a mechanism?
I think that there's a strong possibility that kind of moral injury could be a mechanism. That the research is pretty clear that in general, interpersonally mediated events, have a greater conditional risk for PTSD. But even within, different interpersonally mediated events, the level of kind of attachment or trust in the relationship is directly associated with risk for developing PTSD or complex PTSD. So I think at the heart of the matter for many survivors of interpersonal traumas, there's a profound betrayal.
So something that they previously believed to be true about the world or about themselves or other people has been violated.
Absolutely. Yeah, particularly other people or maybe even themselves, right? That they believed that they were lovable, or they believed that that they could make good decisions in their relationships.
Mhm. So does treatment for PTSD that involves an index trauma that caused moral injury look different from other types of PTSD treatment?
So we're still trying to figure out an answer to that question. So there's kind of two basic approaches, to treating moral injury right now. I think one of the approaches would be to adapt existing empirically supported treatments for PTSD. So for example, prolonged exposure, cognitive processing therapy. These would be two of the kind of paramount ESTs for PTSD. So what many folks are doing with these treatments is just approaching kind of moral injury in the same way as they would approach kind of PTSD from a different type of trauma, a life-threatening event trauma. The second approach is to draw on components of ESTs, such as imaginal exposure, but to incorporate kind of other types of interventions that haven't really received the same level of scientific scrutiny. So for example, there's an emerging treatment called adaptive disclosure, developed by a psychologist named Brett Litz and a psychiatrist named Bill Nash and their colleagues. So in adaptive disclosure, in cases of a perpetration-based moral injury, there you would rely on imaginal exposure in sessions, but you would also incorporate imaginal dialogues throughout the course of treatment. So for example, if someone was responsible for an act of violence or a trauma against somebody else, and they were experiencing profound shame and guilt for transgressing their beliefs and values, you may incorporate interventions where you invite the victim into the session imaginally, and you have that person ask for forgiveness. Or oftentimes people who experience perpetration-based moral injuries, they have a difficult time receiving forgiveness for what they've done. That's sort of that theme of survivor guilt. So you may invite them to imagine the presence of a moral authority in their life. It could be a family member, it could be a pastor or a religious leader, it could be many different people, someone who they really look up to as a moral authority. And you have them explain to this person why they are unable to forgive themselves, right? And so the wisdom, in my view, of adaptive disclosure is recognizing that yes, we need to retain many of the core components of ESTs for PTSD, but they don't seem, to really get to the heart of the matter for promoting healing and moral repair for some people.
How does religion play into PTSD caused by moral injury?
Yeah, very, very good question. So I think it depends on the person. Depends a lot on the person. So for folks who have an internalized faith system, whether it's conventionally religious or not, they're going to make sense of their suffering in alignment with their core beliefs and values, right? So for folks who who have a belief in a higher power or a personal God, and maybe they're participating in a religious community, they're engaging in daily religious practices. Um, Moral injury is not only going to affect them psychologically, relationally, it's also going to affect them spiritually, right? So for folks who are religious, you tend to see a reverberation of distress into the domain of faith or spirituality. And for many morally injured people, the way that they then cope, takes them away or disconnects them from their sacred beliefs and values, right? So we know that, for religious people who experience a moral injury, when they disengage from faith, or when you see a trajectory of weakening of spirituality or faith, they often have the worst outcomes, right? So I think, unfortunately, there is some evidence to suggest that like certain ways of being religious do seem to set people up for developing moral injury, which is a bit of a controversial idea, but unfortunately, many religious people, in terms of a faith development standpoint, they're operating at the level of a 12-year-old, where they tend to see the world in very, very black and white, right or wrong, kind of circumstances. So when they encounter a moral injury, they have no way of sort of kind of reconciling it or making meaning of it. So what ends up happening is they often end up moving from unrealistically positive views of the world themselves that are often defined by their by superficial understandings of what their tradition teaches, and then what they end up doing is they move from highly positive to highly negative, when the truth is going to be somewhere in the gray area in the middle.
Yeah, so this sounds a lot like the process of over-accommodation in cognitive processing
Absolutely.
therapy.
Yeah, absolutely.
So we talked about how people who have more sort of rigid or concrete or black and white worldviews, whether it's religious or not, are more prone to developing
Hmm.
PTSD following a trauma.
Hmm. Yes, absolutely. Yes, it's. I think for many religious people, they're at risk for over accommodation.
So I thought the world was good and fair and that I was safe, but since that isn't true, it must be the opposite.
Yep. Or I think many religious people, who have a theistic belief in God, they they have an unspoken agreement that that if I keep my nose out of trouble and I make good decisions, and I try not to sin, for example, then that means that God is never going to let me experience any pain or
Mhm.
suffering in this life, right? So if that's sort of the understanding, the conception of God that you're operating with, and you encounter moral injury, well, of course you're going to experience considerable dissonance in that relationship.
Great. Well, so for I guess my last question is, in your practice, how do you kind of bring people's faith and spirituality into treating moral injury?
Well, I think right off the bat, there are a series of questions that I like to ask. So in my practice, I like to begin with kind of a self-report intake packet that includes items about religion, spirituality. So asking people, um, you know, in the intake document, do they have a religious affiliation? What is their religious affiliation? I like to include an item right off the bat, that asks people, on a scale of 1 to 5, 1 being not at all important, 5 being extremely important, how important is it for your therapist to incorporate your faith or spirituality in your treatment? So just including that question right off the bat. So if people are endorsing religious affiliations, if they're, reporting that they want to incorporate their faith or spirituality in treatment. I will, want to make sure that I assess for their faith or spirituality initially. So there's a series of questions that I like to ask. First, do you consider yourself a religious or spiritual person? So if someone says, well, I consider myself a religious person, but not a spiritual person. Maybe I consider myself a spiritual person, but not a religious person. And then, we tend to, to use these terms, but we often don't know why people consider themselves religious or spiritual. So then I want to understand, like, well, what makes you what makes you consider yourself a religious person? What makes you consider yourself a spiritual person? If they consider themselves religious, I want to understand: are you part of a community? Um, do you engage in daily practices? Right, and then um, depending on how they respond, I will then ask them, in what ways have you drawn on your faith or your spirituality to cope with your moral injury? Right. So trying to understand how they're drawing strength from their faith. And then ultimately, I will ask them, how has your experience of trauma or moral injury affected you religiously or spiritually? Um, and that's often where you'll hear the themes of accommodation, right? Or you'll hear the themes of disengagement or exiting from faith.
Or if people, would you consider it over assimilation if people were to kind of conclude from experiencing trauma that they must be a bad person or must have sinned?
Absolutely, absolutely, and the folks, who the folks who tend to kind of over assimilate, they're often the ones who have experienced the greatest burden of trauma exposure over the course of their life,
Mm.
right? So for and many folks, who develop moral injury, um, unfortunately, this is often not their first trauma, right? So particularly for folks who have histories of adverse childhood experience or who have been victimized in the past, um, it's very common for them to over assimilate. You tend to see over accommodation with folks for whom it might be their first or one of their first
Mm.
encounters with a trauma.
Makes sense. Well, thank you so much for taking the time to talk about this
Sure,
stuff. Um,
sure.
Really appreciate it.
All right. My pleasure. Be well.
You too.